This video is going to be about how X-ray techs protect patients from radiation. So protecting patients from radiation and trying to reduce patient dose is one of the biggest things, one of the most important things that X-ray techs have to worry about on a day-to-day basis. And so every single time we take pictures, we're always thinking about lowering patient's dose. We position a patient really good and try to make it so that we only have to take the pictures each picture once. We don't have to repeat, because we do have to take several pictures of a certain body part so that the radiologist or the doctor can see what's going on. Because if you only get one 2D picture of a 3D object, you're missing out. So you need to get at least two pictures 90 degrees away from each other. So that's one of the things that we always think about. So we always go by this concept called ALARA, so A-L-A-R-A. It sounds like a girl's name for some reason, but it stands for as low as reasonably achievable. So we always strive to use the least amount of radiation possible with every single picture that we take. So there are 3 cardinal rules to radiation protection, and these rules we implement every single time we take a picture. So these are time, distance, and shielding. So time, you want to decrease the amount of time that you are being exposed to the radiation. And by the way, I feel like this is a really big misconception about the X-ray room. The X-ray is not on all the time. There are patients who get scared whenever they enter the X-ray room. The X-rays are not on unless we are pressing the button down. There is a safety mechanism in the X-ray button. It's like a dead man switch, so it's not, the X-rays do not go unless you are pushing it down enough. Sometimes you can push it halfway down and it won't go, so you have to push it down really good. And then the X-rays are only shooting for less than a second usually. You are not exposed as soon as you enter the X-ray room. You are not exposed as soon as the portable X-ray machine enters your room. The second one of the cardinal rules for radiation protection is distance. You want to increase the amount of distance you have between the source of the X-ray, which is the X-ray tube, and yourself. Unfortunately, patients can't do that because patients have to be in the X-ray beam and they have to be exposed to the X-ray to be able to get an X-ray picture. If you are a family member of the patient, we always tell you to leave the room if we come in with a portable X-ray machine, or we have you stand back behind the wall, so then you won't get X-rayed. The farther you are from the X-ray beam, the less dose you get from the X-ray. The third of the cardinal rules for radiation protection is shielding. So we always try to shield patients whenever possible. So we try to shield your thyroid, and then we also try to shield breasts and gonads, just depending on what kind of X-ray we're taking. Unfortunately, there are certain X-rays that you cannot shield for. For example, if you're getting a pelvis X-ray, that's your hips, both of your hips, and this is all where your gonads are. Unfortunately, females cannot be shielded from that. Males can kind of get shielded. Or getting your chest X-rayed, you are not able to shield your thyroid because the shield would get into the way of the chest, and that would be a pointless picture. We'd have to retake the picture without the shield, so there's no point to it anyways. So those are the 3 things that we always consider when X-raying. So there are 2 factors that X-ray techs always have to balance when taking an X-ray. They are KVP and mass. KVP stands for kilovoltage peak, and mass stands for milliamperage seconds, or milliamp seconds, whatever. We call it setting the technique when we select how high or how low the KVP and the mass are going to be when we X-ray the patient. So KVP and mass control the type of X-rays that are coming out of the X-ray tube when we're shooting the X-ray. And they make the picture look different. So when you take an X-ray, some of the X-rays get totally absorbed by the body, and the areas that the x-ray was totally absorbed will look white in the picture. And then there are areas in the picture where the x-ray just goes through without interacting with the body or getting absorbed by the body, and that's where it looks black. So the black parts are usually air, and the parts of the x-ray that are white are usually bone because of this, because the bone absorbs the x-rays and the air lets the x-rays pass through. KVP, kilovolt peak, controls the amount of energy the x-rays have when they come out of the tube and get shot through you. So some will have high energy, some will have medium energy, and some will have low energy. So the x-rays that have a low energy are more likely to get absorbed by your body, and the x-rays that have high energy are more likely to go through the body. When you have a low KVP, the x-rays have a lower energy, and when you have a higher KVP, the x-rays have a higher energy. The higher the energy of x-rays, the easier they have to pass through the patient without getting absorbed by the patient, which means that if you increase the KVP for a patient, you actually decrease the patient's dose. However, you have to balance it. You can't have it too high, or then scatter will form more often, and it'll make the picture look foggy and a little bit more kind of blurry than what you really want it to look like. The other factor that we have to pay attention to is mass, M-A-S. Mass controls the number of x-rays that exit the x-ray tube. So if you don't use enough mass when you set the technique, it gets this thing that we call quantum model, where it looks really grainy and blotchy and not very clear. So you have to increase the mass enough that the picture looks nice and clear, but not too much, or then that's just too much dose. And then if you don't increase it enough, you will have a bad looking picture, and then you'll have to take the picture again. So we always set different techniques, and it's one of the hard things. You have to kind of memorize it when you are an x-ray tech, but that's another thing that x-ray techs do to decrease a patient's dose. Another thing that x-ray techs do is we use the term collimating. When you collimate, you use little knobs in the x-ray tube that make the light go wider or skinnier, and we always try to collimate so that we have the smallest little area of light possible, so that we're not shooting other parts of the body that are not necessary for the picture. So that helps to decrease patient's dose, and it helps make the picture look prettier too, so you won't have to retake it if the picture ends up looking bad. So collimating is a really, really important part of an x-ray tech's little toolbox to help decrease patient's dose. So another way that we are able to decrease patient's dose is we have digital x-ray machines. So a long time ago, x-ray techs used film, and you'd actually have to use a film and you'd put it up in the light box and look at the x-ray. We don't use film. The good thing about that is that it doesn't take as long to get your picture, because when we x-ray, it just basically immediately pops up onto our computer screen. Fun fact, digital x-ray machines are more sensitive than film, meaning that your dose is decreased by 20 to 50%. So people today are getting less dose from x-rays than they were way back a long time ago when they used film. And I feel like a lot more people nowadays are more afraid of x-rays than they were back then, when they probably should have been worrying. In conclusion, radiation is dangerous, but x-ray techs are trained in radiation safety, so we make sure to keep patients safe. We are always thinking about patients' safety and lowering patients' dose. And we're always trying to improve, and I hope that you find this video interesting, and I hope that learning about this helps make x-rays a little bit less scary. So thank you so much for watching. Bye.